Moore first introduced me to the business, and this is how it went. This is Dr. Steve Moore. Is this Dr. Pharmanex? Yes. I have this great product, click. Calls back. I don't really hang up on him, but that's nice. Dr. Pharmanex, yes, this is Dr. Steve Moore. Oh, hi, yes, I can remember you. And they said, I have this biomarker, this machine that measures biomarkers for nutritional status in your patients. Is this something you'd be interested in? That's nice. I've heard this before. Pieces of hair you send out to somebody who'll give you what vitamins you need. I hear this all the time, as most of the physicians here know. We get approached by vendors quite a bit. And so that's all Steve was to me at first, until he sent me something. I write these.
You know, okay,
yeah.
so talk about
So anyway, the it's much. Those things are. He basically said, "Look, we've got some real science behind this, and I know you have a nutrition and a genetics background, a molecular genetics and nutrition background as well." And he said, "Take a look at this. I have a paper to send you." So he sent me a quick paper, and I saw the name Dr. Mark Bartlett. Mark Bartlett. Because to me, New Skin at that time was oil belay and Mary Kay put together. So it was at the time. And I saw Dr. Mark Bartlett. What's Dr. Mark Bartlett doing with Mary Kay? Because I knew who Dr. Mark Bartlett was at NIH 18 years prior, where I was doing some antioxidant research. And it can't be the same guy. So I looked it up. There's his face. I could hear his New Zealand accent right through the picture. And sure enough, it was Dr. Mark Bartlett, which made me delve further into the science and the people behind it. And then I saw people like Angela Mascaladas and Joe Chang, and then it just escalated from there, and I realized this is not Mary Kay. So then I looked harder at the scanner, realized, oh, this is Raman Spectropty. Oh, this is real science. And from there, it was very easy to understand that this was an idea, this was a tool that I could use that would directly affect my patients right up front, whether they were surgical patients, whether they were weight loss patients, or whether they were primary care patients. And that was easy. That was the easy part. The hard part, of course, as a physician, is what? Oh, you mean there's a business attached to this? I'm sorry, I don't have anything to do with that. And all I cared about was the science, what I could do for my patients initially. And I was slow. I was very slow. 18, 19 months later, I'm still not worrying about the business until my accountant pulled me aside and said, Ben, you need to look at this business a little closer, because the revenue generated from the scanner passively, with just Dr. Gonzalez supporting it initially, the revenue generated from the scanner part of the business is nearing matching your payroll for your entire clinic. Really? Yes, really. Okay, so that's when I started paying attention. And that was a slap in my face, realizing, oh, Steve's been telling me about the business side. I've ignored and put up these big walls. All I cared about was the science and the scanner part. I was able to marry the two, and since then, it's been a little bit different in our clinic. And that's basically it.
Well, we will definitely ask you more questions, because that sounds great. You like ice cream?
Okay. Can you hear me? Okay.
Yes.
You know, it's so good to see Dr. Gonzalez now talk compassionate. And if you know him 2 years ago, and I remember in this kind of setting, not in here, it was in Wells Fargo building. You remember that? It was the summertime. Remember vividly. And he was like, hear the science, everything. Afterwards, he pulled me out in the hallway. He said, you really believe this product? So I looked at him. I said, that time I already had 2 years testing the product. And all my patients finally get so upset with me not to promote. So I look at him straight in his eye. I said, you are a good physician. Have a good heart. I said, go try it. The following month, he came back. So in between, I believe he has all kinds of questions, quite negative that month. The following month, he came back. And we were on the panel. He was sitting in the front row. There was an audience. Now the physician fired the questions. He could not wait for all of us on the panel to answer. He stood up, grabbed the speakerphone. He said, "What kind of the science do you need? I have patients on antidepressant, full antidepressant. I put him on the Lipac Nano. And in 1 month, and he only down to 1 drugs." So I look at him, I was like, whoa, I said, that's impressive. So look at it, short of 2 years, now you make too much money. So on this journey, I was introduced by my boss, the chief of the hematology oncology of the cancer center, who's the one tenure declined him. So the part is relationship. Absolutely, it is important, the relationship. So what I did, I just periodically, I just send a little bit of information. I said, look this patient, look that patient. I think the part for me to come along is the result from the patients. And then, literally 2 years ago, I went to the cancer center committee meetings. We have that quarterly, and I'm sitting in the audience, and everything coming out from the CEO, CFO, is all talk about how many new patients we need in the cancer center. And they look at the revenue, all this stuff, talk nothing but money. So I'm sitting there. There was like 15 of us because it's a leadership, meeting we made regularly. So I'm sitting there, and the chief, my boss, sitting next to me. I look at him, I said, do they always want new patients, new cancer patients? He just rolled his eyeball up in the air. He's like, where have you been? So I told him, I said, West want a new ADR. I said, what's wrong with the new ADR? I should get more new ADR for my patients instead of I get more new cancer patients. So that's 2 years ago, it's like a light bulb went off on me. So from that moment, I believe the business, I have no objections for business. So now when I do the talk, I will say, I am distributor for New Skin Enterprise, and I do have the finance interest. And I'd like to have more so I can do more research next step. Because all the drugs have a drug pharmaceutical company sponsored for research, and nobody sponsored my integrated medicine research. Every time they look at me, they're like, what kind of, value for us? I could not get an acupuncture company sponsor me for acupuncture. Because they say, we know it's work. We don't want to waste the money or time. So the part coming down here to see the company, the science, and I really believe we are the one going to impact in the world for the wellness care. You look at the product, the results with the TR90. It's just so many patients get their life back, their tears in their eye, and being a physician, this is something we could never do it.
Thank you, Amy.
I was originally invited to a professional...
Jeff, can you hold it a little closer?
Originally introduced by being invited to a professional introductory meeting at Dr. Lewis Cady's office. I don't know if you know Dr. Lewis Cady in Emerson, Indiana, but he's kind of like the guru, nerd, rock star of Pharmanex. Anyway, once I saw the scanner and the product and found out how much research was behind these products, I knew it was something that I could use in practice. And, I was originally, for 6 years prior to that, I had a patient who was trying to introduce me to these products, but her name was Chris. She had no filter between her brain and her mouth, and she has about 50 cats. So I had a hard time accepting that invitation at that time. But you never know where you're going to find some good information.
Oh, look for ladies with cats.
So it was 2 years ago that I was riding my bike on a 2.5-hour bike ride, and my brother had challenged me to try Vitality. And I said, no, and he's a pharmacist also. And so finally, after bugging me, I took the Vitality for 3 weeks, and I was riding home after 2.5 hours up behind Stanford University in the hills, and I was keeping up with the young guys. And I was like, not hitting the wall, I was motoring up that hill, and it was like, wow, I must have gotten a lot of sleep. Something. So I told my wife that, and the next day, and then I rode a long ride again, and the same thing happened. And I'm going, could it be those crazy pills my brother's got me taking? And Leah, my niece up there, was going, yeah. And I said, so I took this bottle and I took it into him in the pharmacy because I'd sold my healthcare companies. And I go, Bart, there's got to be a business behind this. And he said, he looks at me and he said, there's a $1 billion business and you ought to see the scanner. And I said, what's that? And that began this adventure because I'd always been into enteroparental nutrition, and I'd always been, I'd hire RDs to help me go through chart review and JACO accreditation. And I knew that nutrition was a basis, but I didn't know how to apply it or how to use it in a business sense. And so I got introduced to this incredible concept of residual income, of health and wellness, which fits in with Obamacare, which fits into our doctors and our healthcare industry being totally turned upside down. And today, that is just something that I really enjoy being part of and promoting. So that's my pleasure.
Thank you. So Terry, it sounds like you're really fast to move forward. So we'd love to hear in your story what specifically finally got your attention.
What really got my attention was patient's result, bottom line, patient's result. Because I've been dealing with oncology patients for 20-some years. I know nutritionally I could get them to a better place. But until I saw what Dr. Amy Muteki had done with some of the patients that I didn't even see, they equally did pretty well. And that turned my eyeballs. And then some of the patients I worked for so long, I couldn't get them further. And then they start to supplement, and I see their lab results dramatically changing. And that completely changed my view about a supplement.
Excellent. So as we go through and kind of ask them how they were introduced, and we just want to point something out. 4 out of the 5 on this panel were introduced by somebody that they knew and that they respected. And it was because of that person's belief in this program and them continuing to move forward is what caught all 4 of your attention. Ben, you were a cold call. So actually a common question we get is, how do you find healthcare professionals? And I was reading some research, and it says 1 in 7 homes in the United States is a home of someone who participates in the healthcare industry. So if you would like to know how to get some of these wonderful people on your team, you just really say, who do you know that is a registered nurse? Who do you know that is a doctor? Who do you know that's a pharmacist? And you can start to use that as a way, and then you can also use cold calling as well. Very effective. Okay, so my next question is, do you just do, well, Ben, actually want to ask you a question about integration, because you obviously seem to be doing something, right? That's quite a lot of substantial income. Could you kind of walk us through a little bit of how you do it in your clinic? Integrate.
Absolutely. Like I said earlier, when I first got it, was simply to screen my patients. In the medical or the surgical world, I was in the surgery, in the surgical world, we tell our patients to do what with their vitamins? Stop. 100%. Tell them to stop. And we all know, as docs, we know, and nurses, and everybody that's in the surgical world know that it's not all the vitamins that are an issue. It's certain vitamins, it's certain it's omegas, it's certain vitamins that prolong eating time, things like that. So it's easier for a doctor, since we only have a few moments to speak to a patient about what to do, and it's easier to say stop everything than to, okay, well, what about this drug? What about this brand? It's just easier to say stop everything. And that's poor advice, isn't it? That's awful advice. It's probably the worst advice. The good news is I had a nutrition background before medical school and during medical school, so I recognize that. So I made some of my patients initially, before the scanner, take vitamin C, zinc, certain types of, exactly. And you notice them nodding their heads. The oncology, the nutrition, people that understand that. Well, but prior to that, how do you quantify to somebody what's your vitamin status or what's your antioxidant status was prior to the scanner? No real way to quantify it. Blood work isn't the best way to do that. It varies from moment to moment, hour to hour sometimes. So this is why I decided in the clinic I had something I could quantify. So if a patient, and we all know that you can look perfectly healthy and have very poor scores. And we know people that eat poorly and have very good scores. So this quantifies, gives you a quantified number. So I was able to quantify that through my wellness patients, my weight loss patients, and at the time what I cared about most was my surgical patients for their optimal outcome. And so it's scanned. If they scored below, for me, my standards, if they're below 40,000, I want them to go on the LifePak Nano, including the omegas, the LifePak Nano or the anti-aging. And if they scored above 40,000, our advice to those patients at the time is, yes, you're in a good range. However, where would you rather be in the tools in your body to fight off disease and to improve your surgical outcome? Would you rather have more tools or the tools you have now into doing that? And that's an easy way to explain it to my patients, is that you want more tools to help improve your recovery time and help improve your outcome. Well, certainly, so if you want that, then we recommend the LifePak Nano. We're to the point now, and I have my brand new office manager, I want to point out to everybody, Ms. Karina Jackson. She understands from the beginning, when she just started with us a few months ago, every single surgical patient goes on the LifePak Nano or anti-aging, period. Or I don't just operate on it, period. I get a list of doctors that are more than happy to operate on you if you're not willing to improve your health outcome. Because why operate if you're not willing to improve your health? What's the point? So we integrate directly to all our patients, to our surgical patients, that for our weight loss patients and wellness patients, I didn't initially, but now we do highly recommend them together, of course, and we go through the whole integrated process of telling them the benefits of the antioxidants and fighting off disease and improving inflammation in their process. And we're to the point now where we're integrating the redesign program for post-surgical care and for post-weight loss, first of all, weight loss protocols, for post-weight protocol maintenance, weight metabolism maintenance. Not weight loss, but weight metabolism maintenance. So that's how we integrate it in our plans. And every patient that comes through the clinic gets scanned, period. Not the vital sign. You go up, take your heart rate, and you get scanned. And how we integrate it is that we have that initial introduction paper that we give to our patients. Initially, as they walk through the door, new or not new. If a patient's family member is sitting in the waiting room, waiting for the patient, guess what they get? They get that paper describing what the antioxidant score is. Would you like to get scored? Would you like to get scanned today? If you do, we'll instead of $20, we'll just charge you $10 while you're waiting for your family member to finish with Dr. Gonzalez. That's how we integrate the system.
How many check no?
We get a few that check no. We do. We definitely get a lot that check no. And most of them, I'd say half probably check no. But guess where that changes? When they come in to see me, and then I say, oh, did you get your antioxidant score? And we say, no. And then I reiterate the importance of it. And then a lot of those no's turns into yeses. And it's just a reinforcement. First you got to introduce. And the introduction is the letter in our clinic, it's that letter. I'm not sure how you guys are doing, but it's our letter of introduction, what the scan score means. And I know what the scanner is, what the scan score means to your health. And then they check, no, it's okay. This is the introduction, you have to do it. And then when they talk to me or when they talk to my weight loss director, my nurse and weight loss director, then we reemphasize what is the importance of it, and it gives a good baseline or a good foundation for the introduction for the next time, and reinforcing what this is all about. And the majority of patients, with a little bit of time, third visit, fourth visit, some at the end of their weight management program or towards weight management program, get scanned. So that's how that works. Any question about that aspect?
Ben, do you charge for the scans?
Absolutely.
Okay. Do you want to tell me how much you charge?
$20. We charge $20 for each scan. Sometimes we'll integrate it into certain, like remember I said that all my surgical patients are required, so we integrate that into the overall cost of the surgical. We just charge the additional 20. We integrate that into the cost, and that I recommend you do. And we're doing that. For our weight management program. I think we are. Yep, we're doing it for all our weight management programs. Whatever the protocols they follow, it's integrated into that cost, and so everyone gets scanned. So everybody gets on the weight management and weight protocols and the surgical side. Yeah.
You said before you operate, they have to go on, like...
They have to, or I don't know.
For how long?
3 months. Yeah, I'm doing 3 months.
Before you
What was that?
Before you
Oh, no, as soon as we do the pre-op, we try to get it done before the pre-op. The idea, especially if they score very low, to me very low is anything below 30 is very low. And if they score very low, I try to get them in as early as possible, get them on the product as early as possible. And then for the 3 months after the surgery, they're required to maintain.
And are you doing repeat scans?
Absolutely.
30, 60, 90?
100%, and that's key for 2 reasons. First, for me as the physician, I want to know if their score is going up, because if it's not, there's something else I need to look at, something underlying that I need to manage or figure out, not manage, but to identify. Number 1. Number 2, retention. And there's value in are you going to take your cholesterol medications if you're not going to get your cholesterol checked
Right.
for 5 years and you don't feel your high cholesterol, you're fine, right? What do we do for any other biomarker in medicine? We check it. We check your diabetic, we check your hemoglobin A1C, we check your cholesterol. We can't prescribe the drug unless we have that quantified, and that's how I feel about the diagnostic.
Patient outcome, healing time, quicker. I want to know what.
Amazing difference. Amazing difference. Now, as healthcare providers, we have to be careful about how we promote, how we say the outcomes. We can't say we're treating, and we got to be careful about that. But I'll tell you one thing, and the difference. There's a huge difference, even with my patients.